and commend all our frontline health workers across the country, and we shall forever be grateful for their service under tremendous strain and challenging conditions. We also recognize and honor all other first responders, frontline staff, and essential workers who have selflessly gone above and beyond the call of duty and ensured that the Kenya flame continued to burn bright. The COVID-19 pandemic began against the backdrop of a steady economic growth rate of 5.4% in 2019. Our focus in implementing the Kenya Vision 2030 and its medium-term plan, dubbed the Big Four Agenda, has been bearing fruit. As a result, most of the major economic sectors evidenced impressive growth last year, including manufacturing, agriculture, tourism, and financial services. However, when it became apparent that the COVID-19 pandemic threatened to erode the significant economic gains we had made in 2019 and preceding years, on the 25th of March 2020, I did announce state interventions to cushion Kenyans against adverse economic effects of COVID-19 pandemic that warranted the national exchequer to forego taxes amounting to Kenya shillings 176 billion. These tax measures included the temporary suspension of the listing with the credit reference bureaus of any person, micro, small and medium enterprise, and corporate entities whose loan accounts had fallen overdue or was in arrears. 2, the immediate reduction of VAT from 16% to 14%. 3, 100% tax relief for all persons earning up to Kenya shillings 24,000. 4, reduction of pay as you earn from 30% to 25%. 5, reduction of corporation tax from 30% to 25%. Indeed, number 6, we did also instruct that all ministries were to pay approximately Kenya shillings 13 billion of verified pending bills so as to improve liquidity in the economy and ensure that businesses remained afloat by enhancing their cash flows, with the private sector also being encouraged to clear all outstanding payments owed within themselves. The Kenya Revenue Authority was directed to expedite the payment of all verified VAT refunds claims amounting to Kenya shillings 10 billion within 3 weeks, or in the alternative, allow the offsetting of withholding VAT in order to improve cash flows for businesses. Number 8, that Kenya shillings 6 billion from the Universal Health Coverage Kitty was to be immediately appropriated strictly towards supporting counties and the recruitment of additional health workers to support in the management of the spread of COVID-19. And number 9, the lowering of the central bank rate from 8.25% to 7.25% so as to prompt commercial banks to lower interest rates applicable to their borrowers and thereby availing much needed affordable credit to micro, small and medium enterprises across the country. Number 10, the lowering of the cash reserve ratio from 5.25% to to 4.25%, so as to provide additional liquidity of Kenya shillings 35 billion to commercial banks in order to directly support borrowers that were distressed as a result of the economic effects of the COVID-19 pandemic. And number 11, that the Central Bank of Kenya was to provide flexibility to banks with regard to the requirements applicable to loan classification and provision of loans that were performing as of the 2nd of March 2020. In addition, my administration, with the support of Parliament, further initiated an 8-point economic stimulus program amounting to some 56.6 billion Kenya shillings. The major objective of the program was to return the economy to the growth trajectory it was on pre-corona by increasing demand for local goods and services, cushioning vulnerable Kenyans, securing household food security for the poor, and creating employment and incomes. More importantly, the program sought to enhance liquidity in support of the business sector, particularly micro and small enterprises. Accordingly, we set aside a further Kenya shillings 5 billion for the operationalization of the credit guarantee scheme. The recovery program also targets to revamp a broad spectrum of economic sectors by hiring 5,000 health workers and 11,000 interns, even as it supports our teachers as they continue to enhance the delivery of knowledge to our children. It further seeks to create 100,000 job opportunities for the youth, besides implementing a subsidized farm input scheme for vulnerable households, and parts of the resource allocated will be utilized on the ongoing fabrication of 250,000 school desks crafted by local artisans. Mr. Speakers, despite the very difficult times that we have faced as a nation, our people have remained resilient. In the face of tremendous economic challenges and the health crisis we are facing, the majority of us have truly been our brother's keeper. Not only have we stood with our family members and friends going through hard times, we have also acted responsibly by following the laid down public health directives. But fellow Kenyans, we are yet to get out of the woods, and so I urge all Kenyans to keep doing that which is honorable and right. As a nation, we will overcome and thereafter soar to even greater heights. Mr. Speaker, the COVID-19 pandemic has brought to the fore the urgent need for us to upscale our implementation of the universal health coverage pillar of our Big Four, which pillar seeks to eradicate the poverty of dignity and transition our nation into an era where no Kenyan should be forced to sell their land in order to settle their medical bills, or be forced to make a choice between buying much-needed medicine and using money to feed their children. An impossible choice. Last year, I informed Parliament that the national government, in partnership with the county governments, was piloting the universal healthcare program in the counties of Nyeri, Machakos, Kisumu, and Isiolo, in preparation for a rollout nationwide. I am pleased today to report that the pilot program for universal healthcare was successfully implemented, and out of it, we have isolated critical turning points, enhancements